Hi, my name is Ikechi Enyoma.
Hi, my name is Flo Bio.
Hi, my name is Rebecca Santos.
Hi, my name is Ashley Trong.
As we age, our body accumulates damages that lead to a wide variety of age-related diseases, such as diabetes and heart diseases. I'm going to be talking about heart disease, and it's interesting because heart disease is the number one cause of death in men and women in the U.S. Heart disease is also a general term that includes the various conditions such as heart attacks, strokes, heart failures, cardiac arrest, coronary arteries, and various other heart disease. The most important heart disease is called CAD. It's a coronary heart disease, which is when the heart's blood supplier is either narrow or blocked. Some current state of knowledge that we figured about heart disease is that plaque buildup thickens and stiffens artery walls, which can cause and inhibit blood flows through the arteries to your organs and tissues. Atherosclerosis is one of the most common causes of cardiovascular diseases. It hardens and narrows the arteries. And although a vast majority of strokes occur in people over 65, the risk is 30 to 50 per 1,000 in that age group. 10% to 15% affect people age 45 and younger, and a risk is in 1 in 1,000. Approximately 30% of people who die from heart disease each year are smokers. Some heart healthy foods to lower your chances of getting heart disease include salmon, ground flax seeds, oatmeal, black or kidney beans, almond, walnuts, red wine, tuna, brown rice, and blueberries. The death rate of heart disease within African American women is significantly higher than Caucasian women. People with diabetes, older adults, and women may not have the classical symptoms or chest pains during a heart attack. They're most likely they're most likely able to suffer shortness of breath, nausea, back pain, or even jaw pain.
As for the controversies, new research says that cholesterol does not cause heart disease in the elderly, and trying to reduce it with drugs like statins is a waste of time, as an international group of experts have claimed. A review of research involving nearly 70,000 people have found that there is no link between what was traditionally thought of as bad cholesterol and the premature deaths of people over the age of 60 from cardiovascular disease. Another controversy is that, according to the U.S. mortality rate for the Center of Disease Control and Prevention, the death rate from heart disease has actually risen about a percent since last year. As for where things are going, the death rates from heart disease in the U.S. have declined nearly 70% since 1969, brought about by the anti-smoking policies and public health campaigns, and the advent of medications to control blood pressure and cholesterol, and the new techniques for saving people's lives from heart attacks. Some symptoms are shortness of breath, fatigue, swollen legs, rapid heartbeat, chest pain, faintness, dizziness, unconsciousness, and some may not even have any symptoms, such as coronary artery disease, and can have a heart attack anywhere and have arrhythmia. And it varies between each person and different types of heart disease since it is such a broad topic.
The next topic that we are going to discuss is diabetes. It is of interest because the growth in the past few decades coincide with changes in lifestyle factors. Diabetes is capable of affecting all the systems of the body. Diabetes also relates with obesity. More than two-thirds of adults are considered to be overweight or obese. More than one-third of adults are considered to be obese. More than 1 in 20 have extreme obesity, and almost 3 in 4 men are considered to be overweight or obese. Diabetes is a chronic and sometimes fatal disease, and 29.1 million Americans are diagnosed with it. It is a disease which the body cannot produce insulin or cannot properly use insulin. Insulin is a hormone that regulates the amount of glucose in the blood. High blood glucose levels can contribute to the inflammation and formation of fatty deposits in blood vessel walls. Over time, that can restrict blood flow and increase the risk of the hardening of the blood vessels, which is said to be atherosclerosis. And the combination of lack of awareness about diabetes and insufficient access to health services can lead to complications such as blindness, amputation, and kidney failures. The current state of knowledge and diabetes is that there are three types of diabetes. Type 1, which is characterized by a lack of insulin production in the body. Type 2, which results from the body's ineffective use of insulin. Gestational, which is a temporary condition that occurs during pregnancy and only pregnancy. In 2005, 1.1 million people died from diabetes, but were recorded as heart disease and kidney failures. 422 million adults have diabetes in the world. 1.5 million deaths are currently attributed to diabetes each year. 1 in 3 adults aged over 18 years are considered to be overweight, and 1 in 10 are considered to be obese. Children can have diabetes. And
With any controversial topic, there shall be different opinions. Diabetes have many different ways to lessen the effects of it, such as surgically placing an artificial pancreas inside the patient, plainly dieting, or actively taking medicine. Artificial pancreas are designed to regulate insulin in people with type 1 diabetes. Insulin is a natural hormone that the body cannot function properly without. Once insulin is destroyed from the body, the proper amount of glucose in the body is not able to be regulated, and the body needs a sufficient amount of glucose to maintain energy in the body. Diets, on the other hand, are seen as a natural form of medication. Some people with type 2 can manage their diabetes with healthy eating and exercise, while people with type 1 diabetes must use insulin therapy, oral medication, or insulin injection. For the future, diabetes population and the related costs are expected to at least double in the next 25 years. Between 2009 and 2034, the number of people with diagnosed and undiagnosed diabetes will increase from 23.7 million to 44.1 million. Annual diabetes-related spending is expected to increase from 113 billion to 336 billion. Symptoms of diabetes are increased thirst, frequent urination, fatigue, tiredness, out of breath, hunger, and blurred vision.